Well, today we're talking about fibroids. You can email your questions to the doctors at WLBT.com. Stephanie Bell-Flint joins us now to talk about fibroids, and if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Lori Fulton with Baptist for Women, and of course you're an OBGYN. Thank you so much for joining us.
Thank
and we're talking today about fibroids.
Yes.
Now, for people who don't know what that is, what exactly is a fibroid?
Interestingly, the word fibroid is actually a bit of a misnomer. It's actually not a fibrous or fibroid growth at all. It's actually a smooth muscle tumor, which is a ball or a growth in the muscle wall of the uterus.
Now, I know that they can cause heavy cycles, menstrual cycles. They can cause cramping, and I know a long time ago the only alternative was a hysterectomy.
Correct. Interestingly, one of the more common things that fibroids cause is nothing at all. A lot of people have fibroids, a lot of women have fibroids and are not aware that they have them. If they do have them and have problems with them, however, you're right, they can have menstrual difficulties, cramping, heavy bleeding. Sometimes difficulty achieving or maintaining a pregnancy can be caused by fibroids too. The key to the problems caused by fibroids is, I sort of laugh when I'm talking to my patients and say it's kind of like real estate. It's location, location, location. Whether the fibroid causes a problem has to do with where it is in the uterus, whether it's in the wall or actually in the cavity itself. That also determines how we can treat that fibroid. And as you say, many years ago, the only option we really had to permanently treat fibroids was a hysterectomy or removal of the uterus. Now we offer so many more what we call minimally invasive treatments for fibroids, including freezing the fibroid, burning the fibroid, going in through the cervix, and sort of almost like a little roto-rooter device and removing the fibroid that way if it's in the cavity. Using robotics now has really sort of revolutionized the way we treat fibroids. We can actually go in and have wrist movement inside the abdominal cavity through tiny surgical openings, actually stitch the area where we've removed the fibroid, and the patients get a much better result and can go home often the next day.
Any idea what causes these? Because it seems like you hear more and more people having them.
I think probably the reason we find more and more women having them is we have a higher index of suspicion. We also have much better ultrasound techniques, diagnostic modalities than we did at one time. It's thought to be caused by one smooth muscle cell that just sort of goes crazy. And it seems to have to do with the genetics or the genetic makeup of that particular cell. It's not malignant, it's not cancerous, but for some reason that cell just decides it's going to go rogue and multiply dramatically. And the size of the fibroid can vary from the size of a pencil eraser to enormous, for lack of a better word. But there's not really an easy explanation for it, but it seems to have to do with the genetics of the cell.
Once you have fibroids, do you always have fibroids, and will they come back if you get them removed? I mean, how chronic is this condition?
That's a really good question too, and unfortunately I don't have a really good answer for you, but I'll give you the answer that I give my patients. There are some patients who have one isolated fibroid. They go in and they have it removed whatever way is chosen by the patient and her healthcare provider. There are other patients who seem to have this recurrent fibroid situation, and that's where we get into the sort of genetics of it that I had mentioned a few minutes ago. We always caution patients that if they have a surgical procedure where they preserve the uterus called a myomectomy, there is a very good chance in some individuals, especially if they've got lots and lots of fibroids, that they will recur.
All right, Dr. Lori Fulton, where are you located at? You're at Baptist. Are you in the Colonnade?
I actually have an office on Lakeland Drive, and I have an office in South Jackson and practice at Baptist for Women. So I've got 2 offices and a hospital location there.
All right, Dr. Lori Fulton, thank you so much
as always.
Thank you so
much for having me.
And for the latest health news, you can log on to our website, WLBT.com, and click on Medical Matters.
Thank you both so much.